Telemedicine became popular during the COVID pandemic, but it's actually been around for several decades. The concept dates back to the mid to late 1800s when doctors used telegraphs and radios to talk to each other and with other people who got sick in remote locations. Telemedicine has become an increasingly popular option for healthcare delivery in recent years. There's a good reason for that. It's like a doctor's appointment, but you get to wear your pajamas and fuzzy slippers and no one can judge you for it. Telemedicine usage increased by 154% between 2013 and 2018. A survey by the American Medical Association found that 28% of physicians used telemedicine to see patients in 2020. That's up from 14% in 2016. Telemedicine, sometimes called telehealth, is very easy. You just schedule an appointment with your healthcare provider and follow instructions to meet them over Zoom or Skype or some other video conferencing platform. The doctor will evaluate you and then fax your prescription for medications or imaging studies and follow-up. Let's talk about the pros and cons now. Here are the 4 pros of telemedicine. Number 1, it's convenient. You don't have to leave your house or office, which means no traffic, no parking, and no waiting room full of sick people who are probably sneezing on everything. Number 2, it's comfortable. You can snuggle up in a recliner and talk to your doctor, plus no more germ exposure from a clinic. Number 3, it's efficient. Telemedicine appointments tend to be shorter than in-person visits because there's less small talk and chit-chat. There's also less time sitting around a waiting room. Number 4, it's very accessible. If you happen to live in a remote area or you have disabilities or mobility problems, telemedicine can be a great way to still get medical care. Now, here are the 4 cons of telemedicine. Number 1, it's hard for some people. If you're not tech savvy, telemedicine can be a bit of a headache. For example, not all devices have cameras, you have to have a good internet connection, and there's a bit of a learning curve to using some of the software. Plus, if there are any technical glitches during the appointment, it can be really frustrating. Number 2, a physical exam is required at times. Let's be honest here, some things just can't be diagnosed or treated through a video call. For example, the obvious things like abdominal pain, sexually transmitted diseases, dental problems, a pap smear, or a prostate exam. I mean, you can't just do that over Zoom. Number 3, it's not always private. Imagine discussing your PMS problems with your mother-in-law in the next room. Personal or sensitive health issues are embarrassing to discuss if you have family members or roommates listening. Number 4, insurance doesn't always pay. Some insurance plans refuse to cover telemedicine appointments, so you might have to pay out of pocket. But now that we've gone through the 4 pros and 4 cons, I think we can all agree that telemedicine is a powerful tool that's transformed the healthcare industry and improved the lives of patients everywhere. By embracing telemedicine, we can all stay healthier and keep it convenient. Hey, thanks for watching. I'm Susie Cohen. I'm a real-life pharmacist, so I know a lot about medications and metabolic pathways. I've been writing medical articles for 30 years. You may have seen me in your local newspaper or some popular morning shows. If you're interested in my advice regarding a specific health topic, I invite you to use the search box at my website, susiecohen.com. I've used my knowledge of pharmaceuticals and herbs to formulate custom dietary supplements and skincare formulas that actually work. Please check the description below for links to my blog and my vitamin shop. Also, hit that subscribe button if you'd like to watch more content like this. Don't forget to ring the notification bell too.